I'm Ayat Abu-Agla, and I'm from the Center for Global Health and also the Sudan Medical Specialisation Board. I'd like to give you an overview on the context of Sudan and why there's a need for this partnership in particular. Sudan, as many countries, has challenges in human resources for health. Critical shortage of the health workforce, geographical distribution, a large country where 70% of the workforce is serving 30%, of the population, skill mix imbalances, doctors to nurses ratio is a 6:1, health labor market imbalances, and huge out-migration of doctors. We have more than 60% of our doctors practicing out of Sudan, and quite many here in Ireland. I'd like to give you a glimpse about the Sudan Medical Specialisation Board. It's the sole professional body mandated to manage and deliver medical and health specialty programs. So if you like, it's like the Royal Colleges altogether. It has more than 33 specialty councils. It's awarded and graduated consultants over 3,500, and I'm one of its graduates in community medicine. That's my specialty. In the pipeline now, there's more than 4,000 candidates enrolled in the different specialties. It awards degree in medical doctorate, fellowships, postgraduate professional diplomas. What's the need? Why? Well, the critical shortage of human resources for health in the country and the international need assigned in the SDGs, especially in the Partnership 1, the Global HRH Strategy, Health Workforce. There's a national need, the National Health Sector Strategy, the National Human Resources for Health Strategy, and the Sudan Medical Specialisation Board Strategy all go towards building partnerships, empowering and enhancing it throughout. I'm speaking not from a desk review point of view, but actually being part of developing these strategies and being part of the reform in the Sudan Medical Specialisation Board. So I'm a graduate within the system, and therefore we have a better understanding of the context and the need within Sudan. Also, as I am the Center for Global Health representing it, we built on our experience with Sudan itself. There have been previous projects with the Ahfad University for Women, with the Ministry of Health. We have students that were enrolled in master's and PhD programs within the Global Health, and staff which are presenting with us now, as Dr. Noha Ibrahim. What's the vision? Well, we have a common goal, working together to strengthen the Sudanese health system. How do we intend to do that? Well, by a training needs assessment to identify the needs in health training and education, identify gaps in policy and practice, and explore possible skill exchanges with Trinity itself. Throughout the previous months, we started communicating with the Sudan Medical Specialisation Board via email, teleconferences. We met in person, and hopefully next week we'll be meeting with the Secretary General during the Health Systems Global in Vancouver. How do we see it strengthening the health systems? At 3 levels. At the health system governance, as I mentioned, the Sudan Medical Specialisation Board is the sole mandated body that actually produces medical and health specialists throughout the country. So its trainees are policymakers, are health managers, are employees of the Ministry of Health in programs, vertical and horizontal, work with NGOs, INGOs, and are basically the health workforce of the country. We'll increase it through health professional education, where the trainers themselves teach the medical and health science students throughout the country. They provide services, whether they're trainers or the graduates, and they form the majority of the health workforce. This is our vision for the partnership. We're not coming in and going out. We want to sit at this potential stage and discuss with them where we can identify the needs and gaps in both our institutes, and hopefully build and train the national capacity to ensure ownership and sustainability according to their needs. Oh. Thank you.